is this related? Is this related to the PDE, or is there something different? And honestly, it seemed like anything neurologic or related to the eyes, yeah, you could probably attribute it to the PDE, but I thought it would be cool to have an online discussion where we can all weigh in with our own experiences, but with sort of a matrix going through body systems, so that we can have a more focused discussion on each part. So I don't know. I have no disclosures. I work as an internal medicine physician in the hospital. So I treat adults. I don't treat children. I don't treat PDE. I'm not a neurologist. But obviously, we know this is something. It's a pathway that's affected in every single cell inside the mitochondria, um, the antiquidin gene. Uh, and so obviously that can affect a lot of different body systems. And the big question is this related to PDE? So the big thing, actually on the Cure PDE website. One of the articles that Anastasia posted and summarized looked at some like 10 Dutch adults and how they did with PDE and what their adult functional status was. But what I thought was really interesting was specifically this one part of the table where they listed clinical history. Um, and they kind of listed other things that the patients have. And I don't know if you can see it on your screens. Those of you on your phones probably can't see this so well, but like several patients have strabismus, which is kind of eye crossing. Several have pes planus, which is flat-footedness, which is honestly like surprisingly common, but I imagine that this was noted because it was causing them some pain or discomfort. Um, and then for those of us who have kids kind of in that preteen or teenage status, there was one patient who also had some developmental issues, hypogonadotrophic hypogonadism, which is kind of an endocrine issue. So the goal for our talk today is to kind of go through and talk about, these were behavioral um, abnormalities that were noted in these patients as well. Autistic traits were noted in 2 patients. This 10th patient, it did seem like it was a very delayed diagnosis. So they were saying that in addition to these things, these additional comorbidities noted for this patient, um, the just the trauma of the birth and the delayed diagnosis itself may have affected this patient's other medical diagnoses. Um, so the plan is that we will go through each of these systems, and I hope everyone can kind of just discuss or ask questions. But at least for me, the big question for all this is if our kids with PDE are more prone to certain medical conditions, does that mean that the management of that condition, for example, strabismus, would be different than a regular kid with strabismus? Or would we do something different with the B6 dosing, or would we adjust the diet based on that? And I think that's the question I want to have on the back of our minds as we talk through all these systems. Uh, so if we're all ready, let's just get started. Um, so big thing is obviously growth and development. The usual questions we ask are when kids first raise their heads or roll over, sit, walk. We know that with PDE, usually that your core, the tone in your core um, is affected. So our kids tend to sit a little bit later, walk a little bit later. I don't know if anybody had any thoughts about that or questions specifically in that sphere?
Feel free to
So,
unmute yourself, I think.
so I can say with my daughter, she's 12 and she didn't crawl. She skipped that. So the definitely we missed the core strength in that, but she was followed by a developmental specialist, so that helped a lot. And then she became a toe walker. She walked still within the range of the quote unquote normal, but like later than most, like my friends now, kids or whatever. But that would be the only thing that I saw. And she's 12 now, so at one point she was in AFOs for a little bit to help with the toe walk, the spasticity from toe walking. So we didn't have the flat-footed stuff or whatever, but she kind of outgrew all of that. So I'm sure the lack of crawling was probably, I would assume it was because of the PDE diagnosis, but I don't really know for sure. We came up with a plan and it seems pretty normal now.
Yeah, I would say what's really interesting in terms of development is that even if we know that the core tone is affected, but the traditional therapies work really well for our kids, and I think that's something really cool. Um, and it sounds like based on Curtis's Dr. Coughlin's prior talks, that also the lysine diet significantly improves functional status in these spheres as well. Um, and that's kind of a general positive thing where we probably notice it, but we probably would not treat it differently. For the older kids, school work, what grade they're in, um, during that toilet training time, overall control. Uh, I hadn't heard anything specifically about continence, and I don't know if anybody else had noticed any issues in the toilet training. I hadn't. In terms of school quality, just school work. Um, I think uh, Anna and I were just talking about it. The ability of the school to support your child is huge in how our kids do. I don't know if anybody else has specific experiences with types of schools that have worked better for their children.
So
Hi,
I
this
would
is
say,
Barb.
oh,
I'm sorry.
sorry. Nope, go ahead. Sorry.
This is Barb. I live in North Carolina. Three of my four children have PDE. Um, all of them have had different aspects of processing delay. All of them have needed support through the school system. I chose to put my children in private school because the public school systems where I lived did not have the supports that they needed. Um, I find it very interesting because my first child was diagnosed in 1996. And at that time, I had neurologists fighting with each other saying that he did not have this because it was so rare in the literature. So it was a back and forth until we found really great neurologists up at Children's National Medical Center in Washington, D.C. And then we were pretty close with Dr. Gosby, who was brought into my conversation because I found him online. He actually told me that my first son did not have it because his EEGs were not classical. And then we found out much later that there is no classical EEG pattern for PDE. So,
Yeah.
but all of my children, my oldest does not have it, and my PDE children range from I have a 17-year-old, a 23-year-old, and a 28-year-old, and the variety of their needs educationally, they're very unique children. There's nothing classic about any of them other than to say broadly they all have some sort of processing delay. All of them were in the Child Find program. All of them received early intervention in speech, expressive speech particularly, and OT. And then my first son, he did receive PT.
Barbara, do you feel like the that was very beneficial. My kid also went through early intervention. I loved it. I thought it was so wonderful.
Oh, it was critical. And I actually became a special ed teacher because of my first son's journey, because I saw the need. So I kind of knew how to navigate that world of encouraging parents who don't even have PED to get their children involved in early intervention if they are seeing signs of delay. So yeah, I don't think we could have my kids. If you saw my kids now, you would say, oh, they look like normal kids. And until you started speaking with them, my middle son has a very, very hard time with expressive speech. He's 23. He has a very hard time with consuming information. He graduated high school. He got accommodations. He was on the track and cross country team. Both my boys are Eagle Scouts, but that's kind of formative with our family and supporting our kids and getting them involved in these healthy activities. So um, when people say once your child is graduated, your job is done, my job has gotten harder and harder because once they're an adult, the world expects them to speak for themselves, and they really cannot. I mean, they can, but when it comes to really this is what you need, um, we didn't find out about the low lysine diet probably until like 4 years ago. We work with Duke University here, Duke University Hospital. And I don't know if any of you've heard of Dr. McCarty. He's kind of considered like one of the experts in PDE here in Duke. But they're wonderful. They have a lot of information. We work with the geneticist there and we work with the dietitian there. And again, two of my children follow that very closely. And my one child, who I said has significant issues, he doesn't seem to think that he needs to follow it. And his mental acuity is declining by the day. So I would say all of those things that are documented are probably good to follow.
So when you talked about the school stuff, um, like Emma's in a public school,
Thank you.
and when she was diagnosed, like the research said there's like an 80% chance of like some learning disability or delay. So I became that parent that was hypersensitive, right? So we learned in second grade, because it's through me being that parent, right? That Emma was struggling with math. So we have went out and got additional math resources and stuff like that. And then this year for seventh grade, now she's in advanced math. Can I say that's PDE related? I have no idea. She could just suck at math and just needed the extra work, right? But because of the limited information that was out there, it made me kind of like Barbara, the advocate, like we all are, the advocate for your kid. So she's never needed the IEP or the extra stuff, but we talk openly about it because she also seems to have a hard time with comprehension. So, but again, is it because she's 12 or is it because she's got PDE? We'll never really know, but I have never had any issues in our schooling history getting her the resources. So, Barbara, your story's pretty impressive.
The only thing I would tell you, Jen, is if you had her tested to give yourself the data for the question you just asked. It can't hurt, especially if you're in the public system. You could ask as a parent for the team to consider that, so you can know how to support your child through end of middle school and high school.
Yeah, so I'm not sure what you're talking about, the testing stuff. She's had a bunch of neuropsych testing done. Is that what you're referring to?
Yeah. Well, it could be neuropsych, but then neuropsych is a little bit different than educational psych. For some systems, they'll only take the educational psych. It really depends on your system.
Yes. Oh, okay. Yeah, so she's definitely had neuropsych done. From the other perspective, at one point she did have we were offered and some of that, like you said, I think it's lifestyle. Like I wish we were the family that sat around on the couch and read books. We're not. We're outside, we're busy, we're active. So It could just be my fault for not encouraging it as much as I should. But when we talk to the teachers, because I do openly discuss the potential of these challenges, they're always, I feel, pretty honest about if they feel like she needs the services. But I'll keep that in mind, because that's as we approach seventh grade, I know it's not going to get easier. So I'll definitely keep that in mind.
Me personally, we actually live in Switzerland. We moved to Switzerland in 2020. So navigating the school system here, totally different. But my own impression is my son's been doing well at school, but I feel like more support is better than less. So I've also been that parent. I completely hear everything you just said about being that parent. That's definitely me as well.
And I normally start the year off warning the teachers that I am that parent. So then that way I'm not obnoxious to them, that I'm hypersensitive and I am that parent. So I think that's helped me not make enemies along this journey.
Barbara, I have a question for you. As adults, what type of support do your kids need the most?
I'd say their biggest need is in the social realm because it's harder for them. I'd say my two boys have strong struggles with expressive speech. Like you and I were speaking, and we're all bantering back and forth. We're hearing each other. We're jumping in. That's not an easy task for them. In the community college system, where you have to self-refer. So if you have accommodations or you have a psychological, that is something they have to do, but I help them with that. Our local community college is amazing. They're very supportive. The teachers are very supportive, almost better than the high school was here. So that's been great for them. Now my son, my first son, he has a whole other side story. I'll tell you this just because when he was 10 months old, he had a grand mal seizure for 5 days, and they were treating him for pyridoxine because they didn't know what they didn't know. And here it was encephalitis, so they weren't stopping the seizure. He had brain damage. He was paralyzed on the right side. So his host of needs were significant when he came out of that. So for him, he's probably the most, he has most intestinal fortitude of any human I ever met. But when he went to school, he is actually a CNA in a health facility. He needs all of those classic accommodations, tests read to, extra time, separate setting, and he receives them. But the world is not kind to people who are older. And we've had to file complaints against these testing companies because they did a variety of things incorrectly, and I know the law well, but he still made it through that, and he's still working, doing well. However, as an adult, like going through high school, I was like you, Jen. I was that parent. The cross country coach had a lot of empathy. The special ed teachers had a lot of empathy. Even the principal, I knew her. So everyone kind of knew my boys' issues, and they would look out for them. So, but if I wasn't that parent, they probably would have fallen far down in the system. And the system tells us, let them fly on their own. But every parent has to choose which road they want to go on when it comes to that. And that's just not a road I could let my kids do on their own, because it's just a facet of the world. Now, my daughter, who's 17, she actually is probably the least affected. And the literature actually says, I don't know if any of you have multiples, it says every child you have with PDE after the first will be significantly more delayed or more impacted. My situation was different because when her name's Vera, when she was born, I was older, I'll be honest, I had her when I was 42. They knew to give me pyridoxine in the third trimester so that she was receiving that in utero. Mm-hmm. So she didn't have her first seizure until 14 days of life. So her her impact has been lesser than my boys, but this processing delay is still there. So she still struggles that way. But she needs different types of supports because she does struggle and she needs the support. So she's going to be a senior next year. So to your question, Anastasia, I just cannot, I have not been able to back down from supporting my children in the educational realm, and I probably never will. Even some of their work bosses, I'll have to go speak to them and say, my child's not really telling you what the issue is. You know, the ADA says you can't discriminate against people with a disability. But I've known for a fact that he hasn't been hired for things that he should have been hired because he works at a little bit of a slower pace. But that's just the way the world is. So we just try to make the best of it and keep trudging along and be positive.
Do your children address, disclose their, I don't want to say disability, but their difference to employers or other people prior to, I would say, running into issues like at work if they're slow?
Well, some of the, when you go on a job application, it will say, please answer these questions. It'll say, I have a disability. I prefer not to disclose. I encourage my kids to do it because I know there's a percentage that have to be hired. Now, depending on the role, like one of the positions that my son applied for did require a bit of speed. And I told him that. I said, this requires you to be kind of a speedy guy. If you put that, they may say, well, this role doesn't allow for that. But anyway, yes, normally they're honest. And we just figure that that's the best way to be transparent and honest. Now, they don't go into the interview and say, hey, I have PDA, give me a special, accommodation.
Right.
They don't do that. They don't do that at all. But in the school setting, they definitely did that to share and let people know. And for the most part, people were accommodating. We have had a few situations where teachers, we're all human, we're all flawed. Some teachers don't have time to give extra time to these students. And that's across the board. I don't think it's specific to our students in particular.
Mm-hmm. Thank you. And growing up, do you feel like your children were progressing kind of like in a linear pattern, or like their progress was just slower than normal, but they were hitting the milestones? Or were there gaps that they were not able to fill? Obviously, like the expressive speech is probably the gap that they're not able to fill and never catch up with that. But what about other gaps?
I would say, I wouldn't say it was linear, but I wouldn't say it was topsy-turvy either. They always needed a bit of support. Dr. McCarty, I love him. He's from Lebanon originally. He told all of my kids one time, he said, look, I'm going to tell you this. You're climbing a mountain, you have a backpack on. Your backpack is always going to be heavier than the other climbers, and you're going to take longer. He said, it's okay. You're going to get to the top. So I always tell my kids that. And I think that's probably the answer I would give you. And for the most part, that's kind of how their situation has been. And what I think I see most is my kids are in the same competitive bucket as everyone else. They will always come in the latter end, but that's okay. They're still in the bucket, and they never made that connection that this could be affected, but I'm glad they're in the bucket.
Mm-hmm. So they do things like all other kids do. They're just maybe not, advancing as far as the others, or
right, or as quickly as
quickly. Yeah,
absolutely.
Mm-hmm.
Absolutely. And all of my kids have this, well, I'd say two of my kids, my one son, I don't know, they have a huge amount of resilience. Like they know that it takes them longer and deeper and wider, but they still keep going.
Mm-hmm. Do you feel like they have special gifts in other areas?
Yeah, I would say my oldest son, he's probably he's one of the kindest humans on the planet. He's almost has a photographic memory that I think was impaired by his grand mal seizure. And I always think, like, what would happen if he didn't have that? My daughter, she's very kind. She's very willing to help everyone and anyone, but she doesn't go around me like, hey, I helped you today. It's just part of who they are. So I think that's part of, I think, what we're trying to inculcate with them. Like, hey, we're all flawed. We're all on the journey. Everyone has issues. Yours just is documented, and it's called this.
Thank you. Appreciate it.
I know I have physical growth on here, but honestly, I had not read about any differences in terms of physical growth or like start of periods or other puberty developmental issues, except for that one patient that was listed in that other study. In terms of behavioral history, I think we touched upon that a little bit. From that Dutch study, their takeaway was actually that there weren't really as many behavioral issues amongst our PDE kids. And Barbara, when you were saying, how positive and how kind our kids are, I kind of feel like that's what I've heard. And based on the other PDE kids we've met, they're very kind and they're really great. And I think that I assume might be associated with just how they, take what they're given and they keep going. I don't know if anybody else wants to kind of brag about their kids at this point, but that has been my observation in terms of behavior.
Mm-hmm. Yeah, my kid is definitely a happy one, and he makes teachers happy, even though he may be like very slow, or his processing is slow, but teachers love him, and the teachers are willing to cut him some slack, I guess, or
I
spend.
got two super nice comments. I do that oh, the places you will go Dr. Seuss book and have the teacher sign it at the end of the year. And sixth grade can be hard, like the transition. And my kid's almost too nice to a fault. She unfortunately, teen years are hard. That's all. I mean, it's just life. It just sucks. But one teacher wrote in there, and another one actually sent me a personal message and just talked about how kind Emma is. And I was like, hey, and her grades were great. She had all A's and like one B. So her grades are good. But I don't focus on that, right? Like we talked, just like Barbara talked about earlier. I tell Emma, I'm like, you're not the kid that it just comes to easily. You're the kid that has to work for your grade. For gymnastics, she's working twice as hard as the person next to her just to be in the same category. It's just the way life is, right? But it made me feel good I see her kindness, right? I know she's kind, but it was nice to see in a setting such as a giant middle school that it was noticed by her teachers.
Yeah, I really have to say, like, maybe we're a self-selecting group, but honestly, it just, that's what I've heard, that our kids are just extraordinarily kind. And that's not so common, especially obviously with maybe a little bit of the generation gap. People always talk about, oh, the kids, they're so self-centered or whatnot, and that's like the opposite. So just a little bit of positivity. Nutrition things, obviously, a lot of our kids are on the lysine restricted diet with or without arginine supplementation. One thing I did think would might affect some of the comorbidities, other diagnoses we notice is just depending on how well our kids are able to follow the diet, how strict the diet is in terms of getting our kids the caloric needs. that they might have issues. And I know I've had conversations with some other parents where the team really wanted to get the numbers below a certain amount, so they were really trying to be extra strict about the diet, but it was affecting the child's ability to have energy and just go through about their day. But otherwise, I don't think there's any specific issues that I've heard about with like food preferences amongst our kids. So just kind of we kind of go head to toe usually in medicine, talking about general issues, weight gain, weight loss, temperature sensitivity, um, following their growth curve, and then of course timing of puberty. I had not really heard of anything specifically. I don't know if any of you have noticed anything with your kids. Obviously, this is the weight gain, weight loss that might be affected whenever you do go on a lysine restricted diet. But otherwise, specific to the disease process, I had not heard anything.
Hey, Jocelyn, we're going to Belize.
We hit those milestones right on time.
Yeah.
No issues.
Eyes are a big one because there's the ocular muscle that can be affected, and that's kind of along the line of torticollis as well. Strabismus, torticollis. It has to do with the muscles which are innervated by the nerves. So I know that a lot of our kids do have strabismus, the crossing of one eye, or central ocular processing changes or issues, and that may be related to seizures because obviously that's affecting the electrical activity of the entire brain. I don't know what everyone else's experiences have been in terms of eyes, vision.
My son Sam had strabismus, and he had surgery to correct it at 10 months old. And the doctors told him he wouldn't need his glasses in middle school, which he came back to normal vision. But then when he was about 20, his eyes started going back to crossing. So again, try to tell a 20-year-old the things he needs to do. It's been rough, but he's back in glasses.
We've had a long journey with strabismus, and still it's not over. Andre is about to have another surgery, the second surgery on his strabismus, and he also does wear glasses. The thing with his eye crossing is that I guess the challenging part is that it has changed over time. It continued changing constantly over his entire life. So the way that his eyes were crossing in the beginning of his life is not the same way that they're crossing now. And after the surgery, they also have moved. They've moved direction and started doing a different thing. Yeah, we've done a vision therapy through a Mind Eye Institute in Chicago. He's wearing glasses with prisms. We've done patching, done all sorts of things. And yeah, lately it's been worse. So we're gonna try to do another surgery.
Nope.
I've heard that other kids with PDE that have strabismus have had surgeries and they were successful. So
How old is your child, Anastasia?
he is turning 13 next month. But I know that his strabismus is sort of like preventing him from being able, to see well, to read well, to to function, because he doesn't have depth perception. He only uses one eye at a time. So helping with that, I feel it's important. And the older they are, from what I've learned, the older they are, the less chances there are that they will start using both eyes at the same time. The issue with strabismus, so it's important to get it fixed early.
I had a question for Carly. She can't make it here, so she was wondering, her daughter Finn has 20/20 eye vision, but depth perception, she says, is really bad. Like if a ball was coming at her, she couldn't catch it. Would that's whatever you guys are talking about?
I think so. What we've been told,
Okay.
that he doesn't have depth perception because he's not using both eyes at the same time.
Okay.
So maybe it's possible that even if she doesn't have strabismus, she's also still not using both of them at the same time.
Okay. Is there anything that she was wondering if there's anything that she can do to help Finn in that sense?
I don't know much about depth perception, but I would definitely go to an ophthalmologist who specializes, probably a neuro-ophthalmologist, and get a consultation.
Okay. I will let her know that. Thank you.
Yeah, specifically eye development, the part of your brain that also processes vision and receives signals from each eye. But the reason why we say earlier is better is because that part of the brain develops as you're growing. So, if you're starting to correct it before the age of 5, that's ideal. But there's still development up through puberty. And a little bit beyond. And if you can correct what's going in through the eye or which eye is being used, whether through patching or through surgeries or the glasses, that can then teach the brain to start using signals from both eyes versus the brain gets used to, oh, I'm only really getting signal. One kid prefers to use one eye. And so the brain gets used to only taking the signals from that other eye, the stronger eye. And the weaker eye, even though it has 20/20 vision, it loses its input into the occipital part of the brain.
And I think that's interesting, right? Because my vision's terrible, right? So, and I don't have PDE, but my right eye, I don't really use it. I use my left eye. So I know, because I realize what we're doing is seeing if there's like a correlation between like PDE and these issues. And I think it's easy to go like, is it PDE related? But sometimes it could just be our genetics or our makeup, right? Like my depth perception's terrible too. I figured it out. I can still play softball, but sometimes I'm thankful my glove is in front of my face, right? So, but and the same way my daughter's figuring some stuff out too. But sometimes I wonder, like, is it PDE related or is it just how she's genetically made up thanks to me and her dad?
Right. So in terms of that second question, does the PDE change how we would manage our vision processing
and I will
issues
say,
or the strabismus?
I don't know if it's changed how we manage it, but it definitely, especially doctors that don't know what PDE really is, she's had a lot of tests that probably the quote unquote normal kids don't get. Like she got like some major eye exam situation in kindergarten and they were like, she'll be in classes by 3rd grade. Well, 3rd grade came and went. We ask her all the time because her dad and I both had bad vision. So we're like, can you see? We're looking for the squints, like, because we always joke, like, you have no hope, kid, you're going to need glasses. But, maybe the PDE counteracted what me and her dad passed down to her. I don't know. That's a joke. I don't think that's true. But, like, there's all those sorts of things. I think from a treatment perspective, I think Emma gets far more, probably because we're such advocates, but probably gets far more testing and availability of different tests because she has PDE.
Yeah, I think especially with eye stuff, PDE should raise our sensitivity level for looking for issues with the eyes. But in terms of treating it, it wouldn't change. And it's not like, oh, we need to try to lower the P6C levels based on the diet or something, just because we're finding this. Rather, it's just more to kind of heighten our awareness that I think our kids pretty frequently have vision processing and then eye muscle issues. And yeah, me and my husband are very nearsighted as well. We've doomed our kids, but it's okay.
So talking about eyes before we get out, my daughter was just diagnosed. She's 15 and was just diagnosed with a white dot syndrome in the center of her eye. So she cannot see at all out of the left eye, which is another real rare condition. I don't think it has anything to do with PDE, but she's always had bad vision in the left eye. And now she's completely blind because of this white dot syndrome. So just thought I would throw that out there in case anybody else comes across that when they're older.
Oh no. Good. Yeah, I mean, that sounds like something also the diagnosis of which is probably difficult. I know probably everybody else has had the same experience where you go through the medical system and it just kind of feels like nobody believes you for a long time. And then we all become that parent, right? Pushing for the test. And I think the one thing this talk I would take away from this talk would be just our discussion shows we find stuff. It's not like our kids are just being difficult or we're just being difficult. I mean, these comorbidities exist. So ear, nose, throat, like postnasal drip, coughing, stuffy nose, getting more frequent colds, snoring. Personally, my son is a snorer, but I don't know if that's related to PDE. I don't know if those of you with older kids, you had to get like the adenoids or the tonsils removed because of snoring. I think my son just really, really relaxes when he sleeps. And so he's a snorer.
Andre does have large tonsils and he snored when he was younger. And he had sleep apnea as well. But in terms of immune system, I would say he has a strong immune system, probably like even above average. He doesn't get as sick as often as others. No sore throat, almost never. Anything to do with throat. Nose, yes, like the stuffy nose, more often. If kids are getting sick at school and they're getting sick with really bad cold and they're out, he would just get a little bit of a stuffy nose, and that's about it. So
But yeah, my
thankfully,
son doesn't
fevers are
really
not
mount
common.
fevers. Yeah, my son doesn't really mount fevers. It's something I know we're all really sensitive to because we're all looking for febrile seizures, which our kids don't have. Teeth, that's to a very specific age group. My son his teeth really like hanging out in his mouth, but I think that is our genetics. The initial first baby teeth came in a little bit later, and then he's changing into adult teeth a little bit later.
Ours were early.
Yeah, I think that really has more to do with the amount of calcium in your diet and just bone turnover, which is not so much related to the PDE. Cardiopulmonary, I put these two.
You spoke about calcium, and I bring this up every time I go to the doctor. Like at least once a year, I have them run Emma's calcium numbers because her teeth are fine. They came in just fine. We lost them quickly. We're good, right? But she has broken 2 rando bones in her foot for stuff that it should not have been broken. So being the paranoid parent that I am, I'm like, it's because she's not drinking calcium. There's no calcium in her diet, right? So I make them check it all the time, and her numbers have always been fine. So I just think it's interesting, and some of that is the old knowledge of what I know as a person versus what's true. But I just think it's funny you talk about the calcium because her teeth have been fine. So
Are they
Anyway,
running vitamin D as well?
yeah, I make them, so once a year I make them run like the full panel because I need to know that I'm giving her a multivitamin that she needs, or if I need to calcium supplement, because it's a challenge to find one that she'll actually take, right? Like, first of all, it's hard to find a calcium vitamin that's appropriate for a 10, 11, 12 year old, and then one that they'll actually take because it needs to taste good because they care about that stuff, right? So, but yeah, I ask annually. So she'll go for her 12-year checkup when she's 12 and a half next month, and I'll ask them to run those same numbers again just to make sure that um, since she has reached her little womanhood situation, to make sure that all of her she's getting all of her nutritional values as best she can.
Um, I have cardiopulmonary together, so heart and lungs. Most frequent in childhood is for the lungs is asthma or bronchitis, and I think we do have a few kids um, who were born with congenital heart disease, either a valve issue or the septum of the heart just developed differently. But I don't think it's more common than the general population. That's been in terms of what I've read. Um, GI, stomach. Uh, my only experience with GI upset outside of any dietary issues has been during diagnosis, when obviously in the neonatal period you look up neonatal seizures, and um, obviously they have pyridoxine dependent epilepsy as a possibility, but they also have Sandifer syndrome, which is basically reflux that causes a kid to kind of shake their head a little bit. But I don't think any of our kids tend to have specific issues with this. Genital urinary, again, really no major issues that I have heard of. Neuromuscular, obviously, there are some comorbidities. One thing that I think Dr. Gosby had mentioned in his talk was just, or maybe in one of the papers, was leg pain. And that they weren't like, it wasn't very specific. Another type of seizure, if you will, that I've heard spoken about is absence seizures, where it's not the generalized shaking. A kid seems to kind of just be dreaming, staring off into space, and then comes back. And those usually tend to start in the teens, like teenage ages. I don't know if anyone specifically had experiences with absence seizures.
Thankfully, we did not.
It is something I've heard of in other PDE patients where it's actually, they don't think that's specifically related to PDE, and they would treat it separately with a different anti-epileptic medication, and torticollis as well. Scott wanted to ask who else was on the diet. Yeah, let's just, the endocrine stuff is not huge. Bleeding, fever shakes, room, and then skin. Nothing major from me on any of those. So I don't know if people want to talk about the diet and their experiences with it.
I did have a
But
question on back on the teeth. My son's 5.5, and he has had these, what the dentist has called, and we've been to 3 different dentists to ask. He has shadow teeth, is what they say. So it looks like a cavity, but there's no hole there. It's just a black dot in the middle of his molars. And he now has 3 of them, but they've touched them, they've poked them, they've done all this stuff. They said they are not soft, they're not any kind of a crevice at all, but it is just a dark spot on the teeth. Has anyone else noticed anything like that, or is he just an oddball?
We haven't had any issues with that.
Haven't had any. Okay.
We haven't either, but my son just turned 2, or he's almost 2, and he was biking on his little strider bike the other day and fell and fully cracked his front tooth. So I was like, is like weak teeth a thing with PDE, or is that just terrible luck? But I didn't know if it was like, it seemed like a pretty harmless fall to break a tooth, and it's like fully chipped up the middle of the tooth.
I don't think it's related directly to the PDE, but maybe more to diet in general. And not specific just to calcium, but whatever other vitamins and minerals we might need, and genetics. I think a lot of the teeth stuff do come from more genetics and bad luck. My son has a lot of friends who have actually cracked their teeth.
Okay, we'll chalk it up to bad luck.
Yeah. He has a friend who's had like their front permanent teeth now repaired 5 times. He just keeps chipping it.
I have a question regarding the flat feet. All 3 of my kids with PDA have flat feet. One of them has my daughter has significant feet issues, and none of the doctors can find anything. She's had x-rays, MRIs, she's had therapy. Is there any kind of guidance on that? Do you know, has anyone seen anything in that path?
I haven't seen any guidance, but we do. Andre does have flexible flat feet, and when we went to the doctor, they said that there was nothing needed to be done about it. So I think it is improving with age. It seems to be improving for him.
My understanding with the flat feet is that the treatment is related to how much pain or discomfort or barriers it's causing for the patient. So, and it is very, very common in the general population. I have flat feet, but I do think this is where probably I do think it might be related to PDE because it is mentioned more. And just making sure it is treated in some way with a good podiatrist. I haven't heard of anything in terms of adjusting the B6 or adjusting the lysine diets due to this issue, though.
What about crossover toe? Has anybody been diagnosed with crossover toe or had issues with that?
No.
That does sound like
has always had that, but I don't know if it was from the braces being too tight when she was small, or the seizures, because she wasn't diagnosed till she was 9 months old, so she was a late diagnosis.
it sounds like that's a neuromuscular issue. Same with the flat feet. The muscles, the way the muscles shape the bones of the feet have to do with how the nerves are getting the signals down there. So I absolutely do think these are related to the PDE. But in terms of how then you treat it, it would be the same as how you would treat it for anybody else. I know there's a lot of activity in the chat. How much B6 people are taking, nutrition, and who's on the diet.
We've never been on any diet. We've only done the B6 since the beginning, because of course it wasn't out back then. We tried it for a couple months and my daughter just couldn't do it and adjust her diet.
If they're not on the diet, are they still like eating meat and everything too?
Yeah.
They eat like a normal diet, hey? Crazy.
She eats chicken, beef, anything. Yeah.
That's awesome.
We don't restrict anything.
We're on the diet, but my son's only 2, so we follow it pretty closely. But he's only allowed 5 grams of counted protein a day, so it is definitely a challenge.
We're not on the diet because I just didn't trust myself to follow it. And we're on 20 milligrams per kilogram of B6 per day. But currently, my son's 8, and we are maxed out at 500 milligrams. He takes 5 tablets in the morning. He just takes it and he gets to like eat a piece of chocolate or drink some iced tea for breakfast.
We're also
Are
on
they?
but we take 2 in the morning and 3 at night. So I don't know. That's just what we've always done.
My
Or
grandson,
your? Oh, sorry. Go ahead.
my grandson is 10 years old now, and he was diagnosed within 24 hours of birth. He's been on B6 since he was a baby, and they're now giving him 500 milligrams, which seems high to me. But so that's why I asked the question of how much people were taking. I also wanted to mention that he's on Gluterex as well as a lysine restricted diet, and that seems to be working very well for him. He's growing quite normally.
Gluterex is the arginine supplementation. Dr. Coughlin, Curtis Coughlin, is the geneticist out of Denver Children's. He had mentioned in his talk the goal is in terms of how much lysine gets into the brain. The idea behind arginine supplementation is that the arginine is more preferably taken up if there's just a lot more arginine around, and that helps with the cognition. That's the thinking.
Can I just tell you guys what we've done recently with the dosing? So my oldest is on, my boys were on 700 milligrams a day, and that was reduced to 600 milligrams like 6 months ago. And Dr. Nakati wanted to see how that looked. My daughter was on 300, and I kept pushing for, how do we know this is right? You know, peripheral neuropathy. My son's 28 years old. I just wanted to know, because the levels were never taken for how is the B6. And Dr. Connie, you could correct me if I'm wrong, but we were always told they'll take it and what they don't use will be just, leave their system through the urine. So I always was questioning, like, why are they on such a high dose? All this, what I was reading. So they finally took a level, and my daughter's level came out higher than my son's level, which my daughter's on a lower dose and my son's on a much higher dose. And the nurse called me and said, "Hey, they said you're fine. Just keep following it." I said, "Well, I don't like that answer. I want a better answer." So Dr. McCarty called Dr. Gosby and said, "What do we say? What do we do?" And they said there's no real science to it, but since they're not having any side effects and the risk of peripheral neuropathy is so low. But my question was, as I shared with you guys earlier, with the different diffuse like processing and stuff, I was wondering if it was just too much. So we're going to check their levels in another 6 months, and it's just an active conversation I'm having. But, I've been dealing with this for 28 years, and this is the very first time their levels were taken through the blood to see what level was B6. So I don't really have a good answer. I'm just sharing that with you because I just don't know what I don't know. I do know this. My son John hasn't had a seizure since he was 10 months old. My son Sam hasn't had a seizure since he was 5 weeks old. And Vera hasn't had a seizure since she was in pre-kindergarten. So we are very blessed in that aspect. So it is working. I just didn't know, I just didn't know what I didn't know.
I just wanted to go back to, sorry, really quick, to this slide. So we actually tend not to check the B6 levels because you're giving super therapeutic doses. If you check it, they should be higher than normal. And that's because this byproduct, because our kids' bodies can't take this aldehyde and make it into this stable acid. So what happens instead is it goes over here, and this compound takes up the B6 that's in your body to stabilize it. So essentially what happens when our kids are born and they have normal levels of B6 in their body, it gets all used up to stabilize this breakdown process of the lysine. And they get their B6 depleted, and that's why they start seizing. So if you measured their B6 levels at that point, they would be normal. And we supplement with it's just really high doses because we just assume that this constantly is going on. So you need extra B6 to stabilize here. And it's sort of a how high can you go? Well, you go as high as you want to make sure seizures are controlled, but they don't have side effects. So there isn't an exact science, but at least in terms of checking the B6, the numbers should be high, and that would not alarm me.
Right. My point, doctor, was my daughter's dose was lower and her level was higher than my son's doses. So I thought in my mind, the way I processed that was their body was using it up quicker. I don't know if that's fallacy.
Yeah, absolutely. And it gets cleared through your kidneys, through the urine. So it just depends on how quickly your kidneys are clearing it. And that's why, like, we're only taking it once a day, but ideally it should be taken twice a day. That's partly my laziness as a parent, probably, because things that are cleared by your kidneys do get cleared out of your blood more quickly.
Okay, my kids have always taken it twice a day.
Yeah, and that's what's recommended in general.
We actually give ours 3 times a day. Tucker takes the Glutarate Essentials now. He was taking Glutarate Junior and then they discontinued it. So he takes the Glutarate Essential and then trying to look, I have it over there. He also takes Dual Cal now to replace some of those calories that he's not getting because of, just the restricted diet. We are very strict with that actually. And he does really, really well with it. So he's grown up knowing that he can't have all of those other like empty calorie foods because he doesn't get any of the cakes, cookies, candy, that sort of thing, which I know sounds like we are total fun, like buzz killers. But when he has extra sugar, his body responds terribly. We actually took him into the neurologist and had him scheduled for a 3-day EEG because he could not process the sugar. He was starting to forget things. He had short-term memory loss, enough to where his teachers were calling and thinking that he was having seizures at school. And that was all from us literally giving him smoothies. He eats a ton of fruits and vegetables, and we thought, okay, we'll make it fun and we'll give it to him as a smoothie, but did not realize that the chemical breakdown for a smoothie starts when you blend the foods together. So he was absorbing more sugar. And it literally made him forget everything. And we really had to work hard to get him back to a normal level. But once he had the sugar levels down and we stopped with smoothies, stopped with that kind of stuff, totally back to normal, on point, brightest little kid. So to replace those calories, we've started the Duo Cal, I think is what it's called. Yeah, Duo Cal. And we give that with the arginine and the B6 3 times a day. Oh, and the Glutarate. Make it up like a little milkshake and he chugs it and he's good.
Oh my God.
How long do y'all follow this diet? Is this like a lifelong diet that you're supposed to do, or does it end at puberty once they're already matured? Or
We were told that it would be something that once he is out of his, his growth stage. So maybe once, now this is all, I don't know, I'm sure it's different for every person and every, medical person would say something different, but we were told that he would need to follow it pretty strictly until he was out of his growth age. So probably, until about 25 or so to where he's fully developed. Because what we were told is that while his brain is doing more developing, that's when it's more important as far as for the lysine restriction. We've worked him up to, with our doctor's approval, of course, or the nutritionist, we've worked him up to 10 grams of protein, like 8 to 10 per meal 3 times a day. So he gets roughly 27 to 30 grams of protein a day. But he's also completely, oh, not completely, but he doesn't get all the empty calories of the sugar and the oils, that kind of stuff. If he has that, we do see negative results from him. Not trying to be a total crunchy parent, because I have a sitting right here on my desk. So we're definitely not that type, but we do see for him, he has a much better response to just life in general if we are very strict on that diet.
How old is he?
He's 5.5.
5.5.
And he has been on that diet since he was 15 months, or actually probably about 16 months. He was very, very advanced for his age early on. We did not realize that as far as speech, stuff like that. At 12 and 13 months, he had about 20 words and was doing extremely well. He was diagnosed or started having seizures at 7 days old, and then we were diagnosed through blood test at about 2 months. But we started B6 right away after the hospital sent at 8 days, just as a precaution, because they said it can't hurt him to have the extra B6. He will pee it out if he doesn't need it. But they thought this might be what it comes back as. So as precaution, they gave us extra B6. So we've been on it almost since birth. And we were only taking the B6. They were not increasing the dosage, even though we were asking, saying he's doubled in weight since we started. Can we increase the B6, for grams per kilogram? And our neurologist at the time said, no, I think we'll be okay with this. We brought forth to him the triple therapy. He said, no, you're fine. We won't change anything unless something happens. Well, I wasn't really willing to wait for something to happen, because I didn't want to see him have any neurodeficits or anything like that if they could be avoided. He seemed like everything was still going fine, developing normally, and then had a very, very bad seizure at 15 months old. And at that point, the doctor, we jumped ship. We said, we're going somewhere else. We have to see what we can do. And we were referred through, I think it was actually this Facebook, or through the PDE Facebook page, and said, to contact Dr. Gaspy. He got us in at St. Louis Children's right away with someone that he had worked with closely with studying before. And she said, let's do the triple therapy. And we saw a totally different kid after that. With that seizure, though, he did lose all speech and went completely backwards as far as walking or anything like that. So we did have to then become therapy intensive from that point forward. And we have kept him in therapy, but just as basically more as a precaution than anything. He does have a lot of core strength that he's lacking, or I should say he is lacking all the core strength. And he does have the severe in-towing, but other than that, he is doing pretty well. But we do see a great result with the diet.
I think it was a couple of webinars ago, but somebody who helped senior citizens said that 2 of the senior citizens she helps were diagnosed with PDE. They're in their 60s, and they started the lysine restriction diet, and they were telling her that they felt much clearer, much more lucid, and it was easier to think through, which I thought that was really cool to get that perspective.
Yeah, Tucker's exact words, if he has too much lysine, or, if we're at a barbecue or something and we're like, okay, go ahead and, eat whatever, and we'll have 15 grams of this meal, and then we'll just go easy tonight and have a salad or something like that. His exact words would be like, Mom, my head feels really heavy and my words don't want to come out of my mouth. He will, but he notices his thought process is not as clear at that point.
Connie, I have a question. I think when I read the Dutch study a few years ago when it came out, or maybe a year ago, there was a mention of tremors in adults. Do you remember?
Yeah, they mentioned that several of the adults had tremors, and the ones who didn't mention tremors specifically, just they even said they had issues walking in a straight line. That was something that was specifically difficult, and they had pointed that out. I was thinking that that may have been related to the development of the back part of your brain, the posterior part of your brain, we call the dorsal column.
Mm-hmm.
I didn't think it was related to the B6 at all, though. Because specifically with the B6, obviously we're always on the lookout for neuropathy, but that I did see that. I had not heard about it, tremors at all with any of this younger generation either. I don't know if anybody has had experience with tremors.
My son has mild tremors in his hands.
Okay.
It didn't seem hasn't seemed to have gotten any worse. So I think it's the same since it showed up.
The other paper that I think the most recent kind of thorough review of PDE that they had published, they had mentioned that there was also some sort of thinking where maybe there was a gradual deposition of some of these protein byproducts in the brain, and they kind of made an analogy to like the way dementia develops with like fibrin deposits as a possible way that PDE seems to affect our kids. But I think all that is theory because in the older adults they had described who were diagnosed in the 50s, 60s, just clinically, it didn't seem like they had that worsening in their function at all. So I think it's all conjecture. But so much has happened since 2005 when they first came up with that genetic test. It is very, very cool that we were diagnosed. For me, that we were diagnosed, after the availability of all these tests, because it's stressful no matter what. But the additional stress that like Barbara probably went through, I can't even imagine.
I have to say, what Carly just described with her young son, like that is exactly what I'm seeing with my son who will not follow the lysine diet. He cannot even formulate words. And I say to him, I'm an educator by trade and I have a lot of energy. And I say to him, Sam, your brain is turning into mush because you will not listen to guidance. He's 23, thinks he knows it all. He eats horribly, more on the sugar side being carbohydrates. Even the dietitian at Duke told him he loves to drink milk. She said, 1 glass of milk, you've killed your requirement for the day of lysine. You don't need to do that. What does he do? He drinks milk. So if Carly could like write down what she said, if for me, what I'm seeing is I have so much hope for you guys where your kids are younger because you have these supports at your fingertips where I didn't have it. And the brain, the brain informs everything we do. So I'm just going to take this back to my family, especially my son, and say, look, there was evidence on this call of what I'm telling you is happening to your brain. And I even shared to him, Sam, if you continue to do this, you will not be able to even have a conversation with people in a few years, and you're only 23. So if I could leave you guys with anything, it is really important to know, stay up on these new strategies that's coming out in the literature to help the brain, because it's a metabolic disorder and everything we put in our mouth affects that.
Absolutely. Barbara, are your kids supplementing with arginine?
Yes, ma'am.
Okay.
But he refuses.
Oh, he refuses to take arginine?
He refuses, and he refuses to follow the diet.
Mm-hmm. Okay.
And I mean, unless I put a chokehold on him and pour it down his throat, there's nothing I can do.
Right, because he's grown. Right?
Exactly.
That's his own opinion.
Like I said, we just found out about this diet through our medical folks probably 2.5 years ago. So.
Okay. I think we're coming to an end. We have run out of time. Thank you, everyone. Thank you, Connie, for hosting this event. It was very informative. And does anyone have any last question they would like to ask?
Scott wrote in the chat if for information on this diet, Scott, if you go to curepde.org, that's the website that Anna's sister Anastasia and Anna have put together. They have information on this diet, and I think they have links. The website is really, really well done. They have links kind of connecting you to people, but in terms of your medical community or home, the way to get on this diet would be to either talk to your neurologist to get the referral to genetics or metabolics. Either department can handle this, or directly refer yourself to that department at your nearest children's hospital. A lot of the geneticists and nutritionists working on this are so nice, and they're very happy to kind of reach out and help get you what you need to get started. So, thank you again, Anna.
Thank you. Thank you, guys. We'll see you next month.
Thank you so much.
Thank you.
Thank you.